This is me Gayatri Prakash and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today I would like to discuss with you all about 5th of November 2022 OET exam, in which I am going to explain to you all about regarding OET writing. Okay, so let's move on to the topic. So what was the letter? It was a known case letter, writing a letter to a patient's GP. So let's enter into the patient details. What was the case notes? Patient name was Peter Simpson, and he lives with his wife. The wife is suffering with the Parkinson disease, and apart from that, patient has high blood pressure, and he is on medication for the same. Very recently, patient has completed left knee total replacement surgery, and he got discharged to home. And after he gone to the home, and he was under the care of district nurse because he had a visit with the district nurse as a follow-up visit after the surgery. So during the first visit, patient gone to the district nurse to remove his staples, and the staples were removed successfully, and the wound also healed well, and the nurse advised him to continue with the physiotherapy and the medications along with that dietary management. And during the second visit, during the second follow-up, the nurse assessed the patient condition, and the nurse came to know that the patient wound is infected with the redness as well as swelling, and also with the edema. Therefore, and also patient's blood pressure was bit high, and the nurse was explained to the patient it is very important to take adequate rest and also continue the physiotherapy. Along with that, patient has to continue the medications. So these all are the very important. Because of the poor medication compliance and physiotherapy only, these symptoms appeared for the patient. And during the third visit, patient appeared with a low mood, and the nurse came to know that the patient has depression, and also patient explained to the nurse that I couldn't continue with the physiotherapy because of my ankle swelling. And the nurse said to him, so you have to take adequate rest and look after yourself, continue the prescriptions what doctor has prescribed to you. And the last follow-up visit, patient appeared with his wife. The both were wearing the dirty clothes. So the nurse came to know that so something wrong and they need a help. And also patient was dull, and he was having a very low mood. So the nurse writing a letter to the GP to make to do a full health assessment and further investigations to identify the reason behind the depression. Apart from that, what they needs like household chores or home health services, that also if possible which he is saying to the doctor to arrange it for the patients. So this is the case note of the Peter Simpson. Okay, so now how we can write a letter. First of all, we have to write the date of the letter. So the date they have given in the letter is today's date, 8th of January 2022. And then address, writing a patient's GP's address, and then salutation, writing a patient like dear doctor, his surname we are writing if the name has given, otherwise we can write dear doctor, that's enough. In the reference, patient name Mr. Peter Simpson. If they have given date of birth, we can write a date of birth, or else we can write a age of the patient. Now coming to the point of introduction. So to make an introduction, we need three vital things. One is patient full name, purpose, and then patient condition. So here we are suspecting that patient is having depression. So but we don't know what it is, either because of the overwork, or either because of the loneliness, either because of the age factor, or either because of the infection, post-surgical infection. Okay, so we don't know what it is, so that's why we are writing this letter to the patient's GP to make a full assessment of the patient condition and further investigation to know more about his suspicion. Okay, so we are just writing a letter. I'm writing to update the current condition of Mr. Peter Simpson. Why we are writing? I'm writing to update the current condition because it is a known case letter, so we are just updating, not referring the patient. Okay, so that's why we are writing. I'm writing to update the current condition of Mr. Peter Simpson, who is suspected to have depression following a left total knee replacement surgery. Full stop. He requires your full health assessment as well as investigations. That's it. Now, present medical history. From the present medical history paragraph, we have to start to write the follow-up visits. So during the first visit, what happened? Second visit, third visit, fourth visit. And we are not supposed to write the social background because of the known case letter. So the GP knows about the patient condition and what it is, how it is. Only he does not know from the first day first of the follow-up to until the day last of the follow-up visits. So that's why the district nurse is writing this letter. Okay. So first thing is during the first visit, or like if they have given the date, you can write the date. Start with the date. You can start with the date. So you can stress during the first follow-up visit, patient presented for the clip removal, and the clips were removed successfully, and advise the patient continue the antibiotics, physiotherapies, medications along with the dietary management, adequate rest. And during the second visit, patient presented with infected wound, infected wound and redness of the wound, and then what happened, and also there was an edema of the ankle region. So the nurse was advised the patient to, so she was advised to continue the physiotherapy, compliance with the medications, along with the dietary management, adequate rest. And during the third visit, patient looks dull, and also patient appeared with a low mood, and with the patient stated that he couldn't continue the physiotherapy due to the ankle edematous of the ankle region. Okay, so the nurse advised him to again the same, please continue these things and take a rest. But she suspected that something is wrong with the patient condition mentally, so that she suspected he might have a depression. And then during the last visit, patient and the patient bystander appeared. Like we can say, Mr. Peter and his wife appeared with the dirty clothes and with a low mood. And then she's writing also, it would be greatly appreciated if you could assist him fully, and do further investigations and perform further investigation in terms of to know more about the reason behind the depression. Like that she can write, and most importantly arrange a home help services for them. So that's it. Now please contact me for further queries. Then you are writing like your patient doctor's name given in the address, you are writing a letter with your completing the letter with your sincerely, or else you are completing letter with the faithfully. So it was a very simple letter, and it easy to write it also. I hope whomever has done your exam on the 5th of November, you all might done in a good way. So hope for the best result. Whomever wants to join in our class, our number has given in our description. You can contact us at any time. We have a crash course, and we have a 2 modules like writing and speaking separately. Also we are taking the classes, and also we have 10 days, 20 days, 15 days, 30 days and 60 days, 40 days package classes also is going on. So whomever wants to take a class, you can contact us at any time. So until then, bye bye.